We have to ensure that we have got young, experienced researchers, men and women, who have completed their advanced qualifications, have gained experience with established research teams, and then eventually are capable of becoming our new generation of research leaders.
Dr. Chris Pemberton is investigating a new way to accurately diagnose heart attacks more quickly and efficiently.
Cardiac disease in New Zealand is enormous, and it's enormous worldwide. Now, there are probably several reasons for that, but one of the single biggest driving factors at the moment in terms of heart disease is the obesity epidemic. People, they're sedentary, they're not exercising, they're not eating the right foods, and so that has consequences down the line. It is epidemic proportions. The single biggest killer of patients with metabolic or obesity-related disorders is cardiovascular disease. It might be a heart attack, it might be a stroke, it might be some other peripheral vascular disease. It's a real problem, and they're doing their darndest to fund it and to solve the problem and how we can educate and provide new therapies for people to do that.
Work by Māori health researcher Emma Wyeth is helping bridge the gap between decision-making, policy formation and grassroots community health.
I have a passion for Māori health, and the Health Research Council of New Zealand have provided this opportunity for me to further my career and pursue further research within the Māori health arena. I've been looking at the genetics of rheumatoid arthritis and gout within a Māori cohort, looking at regions in the genome that provide susceptibility or protection for these two diseases. Gout is a hugely prevalent disease within the Māori population, and it's a complex disease. It's influenced by environmental and genetic factors. Within my research, I've developed a new tool that's enabled case control analysis to be carried out in the Māori population, taking into account the presence of admixture or different ethnicities within our present-day Māori population. And then I've used that tool and applied it to rheumatoid arthritis and gout. During my research, I've been out in the community quite a lot, talking to my whānau and gathering whakapapa and things, and during the next 4 years my projects that I'll be working on will also enable me to get out into the community. So long term, I would like my research to contribute to a better health of the Māori population.
The Health Research Council of New Zealand also supports research that leads to commercial success. Professors Bill Wilson and Bill Denny from the University of Auckland are developing anti-cancer prodrugs like PR104, together with a leading global biotechnology company, Proactor Therapeutics.
What we're seeking to do is to really build a broad portfolio of research around exploiting the abnormalities in the physiology of solid tumours. And PR104 is the beginning point in that. We've got a series of other molecules and other approaches in the pipeline that build on the experience that we've achieved with PR104, but hopefully will take this concept even further.
They take advantage of a physiological property that solid tumours have that normal tissue doesn't, the presence of hypoxia, and we've been able to exploit that significant difference between tumour cells and normal cells to turn on these prodrugs.
The ideas that lie behind the development of PR104 started over 20 years ago, and it's been the continuity of funding through the Health Research Council of New Zealand that's made it possible for us to bring in the multidisciplinary team that's been needed to elaborate those ideas and turn it into a clinical product that's now in clinical evaluation.
The Health Research Council is involved in a range of successful partnerships. These include the Partnership Program, which works by engaging a variety of agencies with related goals to work together and invest in high-quality research. The Health Research Council also invests in research to tackle the health priorities of New Zealand's district health boards and is linked into a network of research investment which has seen it partner with a number of countries around the world.
High-quality health research is the mission of the Health Research Council of New Zealand. That's what we invest in, that's what we want to succeed with.